Now, I'm sure that you've got so many questions going through your mind regarding health during the nationwide lockdown. So we've brought in the expert. Dr. G is the Chief Wellness Officer at Medispace Lifestyle Institute, and she is here to answer all of our burning questions and how we can keep really healthy and very safe at home. Welcome to the show.
Thanks, Jeannie. It's good to be here.
So lovely to have you here. So, I mean, these last few weeks have just been chaotic. We've heard so much propaganda, so much fake news. There's just so much information flying around, and it's very difficult to sometimes ascertain what is real, what is fake, what is actually going on.
I hear you.
So just while everyone is now at home, in the middle of lockdown, let's start from the very beginning.
Okay.
Let's break down what exactly is this COVID? What should we know about what it is?
I think the first place is for us to just have a very simple understanding of what a virus is and what it does. So in a nutshell, a virus is an infectious agent that tends to steal the reproductive DNA of a host cell, in this case, obviously, because it can infect humans, let's say a human cell, and then it multiplies really rapidly. But it's an infectious agent. So I think that's the first term people need to understand. Coronavirus, before we get to even COVID, is already an existing group of viruses that cause mild to severe respiratory-like diseases and symptoms. So one of the main reasons that it's really important for us to understand COVID-19 is because it's a new strain in a family of 7 other existing coronaviruses. And they then are spread.
And we didn't know that it existed until now.
Well, this particular strain.
Okay.
So there are, like I said, 7 other known coronavirus types that cause, like I said, from mild to severe respiratory illnesses, which means that it's most commonly going to affect your lungs. And then there's obviously complications. And the main reason this is important is obviously because when the first outbreak of the new type was discovered in China, as scientists, we naturally must jump on, figure out what it is, and then contain the spread. And the entire process that the whole world, I nearly said universe, at this point it feels like our whole universe has changed, right? The whole process of what's been happening globally is really now to contain the impact of what the disease does to humans.
Okay. Will the disease just go away? Like if we all just stay at home now, obviously the disease is moved through people moving and people touching.
Correct.
But is it just going to go away by people just staying at home? How
think,
effective can this lockdown be?
So I think the beauty of respecting how infectious patterns work is that, of course, mobility will definitely contain the spread. The most important thing we're trying to stop is what we call transmissibility. So it going from one human being to another. Because if you can stop that as your first preventive measure, you obviously start to reduce the numbers. And that's why flatten the curve is such a popular statement right now, is initially infectious agents do tend to peak and spike if there's a lot of mobility. So we really appreciate and respect, obviously, the lockdown concept, because at this point, we don't want to find ourselves in crisis mode. We want to be able to stabilize the existing number of people that are infected. And I think it's important to also appreciate, because there's this interesting notion of, but if lockdown happens and the numbers increase, then this isn't effective. It is. Because at this point, the numbers are going to continue to increase because we're still making sure we're detecting and finding out who's got it, who doesn't have it. But they won't increase to such drastic measures, which is why we have to follow suit of really amazing countries who've managed to stop the spread.
Why does it affect different people differently? Like, I know I've been watching the worst. No, but it's so sad. I've been watching the most horrific footage coming out of Italy. And then I've got three people that have it, and they are actually totally fine. So why is it affecting different people?
Okay, so the most important thing is there's a very general principle we also say in science, which is the stronger you arrive at something unexpected, like a viral infection, usually the quicker you will recover. So stronger is a very relative concept, but let me try and break it down scientifically. A lot of us describe being healthy in a very subjective experience. In terms of science, it's how resilient are your organs at the time that you are hit by something like this. So I've already talked about the fact that this particular strain obviously tends to cause, in a serious case, it tends to cause what we call a severe acute respiratory syndrome. So it's very similar to a previous virus that used to cause something called SARS, and some people will remember that. So it's a typical strain related to that. Therefore, individuals who are older, so the elderly, are more vulnerable naturally because at that point, your organs aren't at their best anymore. You're in a state of decline. Individuals who've got specific chronic medical conditions are the second group that are often at risk as well. So especially if you've got a pre-existing lung disease.
Okay.
And that's really
I'm
the big
asthmatic,
one.
which is actually what's freaking me out the most.
So unfortunately, you fit in the group of where we have to really be careful around your risk, because if you look at what it does, as an infectious agent, it causes inflammation around the lung tissues, which makes it difficult to breathe. Now, you already are talking about an obstructive lung disease, which makes it difficult for you to breathe, but also asthma is associated with inflammation.
But also, that's what scares me the most about COVID, is because I know what it feels like to not be able to breathe. So it's a very horrible death if somebody does die from it. It's punishing.
The unfortunate thing is that even though we're sitting at a 4-5% mortality rate globally, that's a very serious experience for the family of that loved one, for that loved one. So in science, our goal is to save all lives. And that's why certain measures had to happen at different stages of the spread of the virus. And to be really, really frank, commending the Department of Health and the government as a whole in acting really early with that, because we have to look at the burden of disease in the country as well. We have a lot of people who have pre-existing chronic medical conditions in South Africa, and you don't want to play Russian roulette, so to speak, with their lives.
Sure. We know that it's extremely contagious, but when is it contagious? So with a lot of other diseases, sometimes it's only contagious when you're showing symptoms, sometimes just before you show symptoms.
Okay.
How long is the contagion of this? And also, once you've had it, can you get it again?
Okay.
Or do you then have an immunity towards it?
So when you just look at respiratory-related viruses in general, so I'll take the most common example, flu.
Yeah.
And it's so interesting to be able to then answer what we predict will happen with corona because of what we see with flu. A lot of us already have some built-up immunity of flu strains, but sometimes every year we get new strains of influenza virus. The most important thing to also appreciate about the coronavirus is that we're 3-4 months into studying it. So a lot of the work is going into appreciating what is the impact in the immune system, what are the white blood cells doing as a way of building up immunity in the mild cases. I mean, it's also good to talk about the fact that in most individuals in the world, it causes a mild disease and people are recovering. But I think because we're still in the very early stage of recovering, it takes a couple more months for us to be able to answer things like reinfection, because right now what we're reporting on is on the cases that were found, the cases that have been treated, the cases that have recovered, and they'll definitely be tracking of those individuals that have recovered. It's called contact tracing. And I think a few months from now, we'll definitely be able to give some answers on the reinfection.
Another concern that I have is with our stats. There's a lot of people who maybe have it that haven't been tested. How do you know when to get tested?
Okay. So one of the most important things that we're making sure we're defining for the population is we are entering our typical flu season. It's natural that everyone is suddenly going to have a cough and a sneeze and go, I might have corona. So the first thing is take a moment, breathe. The second thing to experience and appreciate is that this particular strain tends to have a typical pattern, which is why we've put out certain information on which symptoms to pay attention to. A very high fever is a very important thing to pick up the phone and call the hotline just to verify. Especially when you're looking at a dry cough that's been a couple of days long, shortness of breath, and then the other respiratory-like symptoms. So mild flu-like symptoms, which often start in the upper nasal tract, without very significant changes, without a travel history or contact with someone who is a confirmed COVID-positive case, is not really cause for concern. We are very well aware, though, that the public is going to panic. And so one of the biggest points of departure here is that the hotline is there. If you're concerned, you don't want to be going out of your mind in a conversation like this, pick up the phone, describe your symptoms. There are qualified professionals on the other line, and they will help you navigate, is it time to test, is it not? Otherwise, one of the biggest things that we're obviously still encouraging is while we're at home and we're getting the traditional sniffles, hygiene, safety.
Yeah.
That's how we...
Yeah, the World Health Organization released that how to wash your
20
hands properly.
seconds.
But you know what I did? So I was doing the World Health Organization 20-second wash your hands thing. And then I touched my basin before I go, and then I think, oh, well. So what I do is now I've got to clean the whole basin. Then I realize I've touched the tap, now I've got to clean the whole tap. Everything I'm touching is now spotless in my house. You could eat off my floors at the moment.
That's what we want to hear. And by the way, past the coronavirus, the biggest culture we are grateful in the medical community that's been taught here is how we should actually be washing our hands on a daily basis.
Amen. Yeah. Listen, you are so fantastic. I want you on speed dial as my new favorite doctor. You are just amazing. Thank you so much for being so helpful. Please do take a lot of care during your lockdown.
We really are.
Of course, we're all staying at home. So make sure that you keep washing your hands regularly. Avoid touching your face. I know it's so difficult. I don't stop touching mine. And also, step outside to get a little bit of fresh air, even if it's just for a very short while, as long as you do it alone. We are all in this together. We are all here for your support. We'll see you right after the break.